So, Horner syndrome and sympathetic pathway to the eye. Sympathetic pathway to the eye is a three-order neuron pathway. Three-order neuron pathway. The first order neuron arises from the hypothalamus. This you have been seeing in the figure. So this is the first order neuron which arises in the hypothalamus and it travels down to the brainstem and then it comes along the upper spinal cord, cervical spinal cord, and at the level of C8, T1 and T2 they relay. This center is called ciliospinal center of Butch. Ciliospinal center of Butch. From here, the second order neurons. So, the second order neurons, they travel from the intermediate column of Gray, they travel to the inferior cervical ganglion. So, from the inferior cervical ganglion and it travels below the subclavian artery. Before going to the subclavian artery, there is lung apex here, and then below the subclavian artery, and it goes from the middle cervical ganglion and then relays at the superior cervical ganglion. It is called superior cervical ganglion. Then from the superior cervical ganglion, use another color, like yellow. From the superior cervical ganglion, it traverses at the bifurcation of common carotid artery into external carotid artery and internal carotid artery. The fibers which are going to those traveling to the face, like sweat fibers, they go along the external carotid artery, and then which goes to the eye, they go along the internal carotid artery through the first V1, ophthalmic branch of V1. Through the ophthalmic nerve, it innervates the tarsal muscles, Muller's muscles in the eyelids, and also pupillary dilator fibers. So this is regarding sympathetic innervation to the eye. Now coming to Horner syndrome. Horner syndrome occurs when there is problem in first order neurons, second order neurons, or third order neurons. It is characterized by 5 components. One is ptosis. This is secondary to Muller's muscle involvement. Muller's muscle is helpful in elevation of eyelid, like 1 to 2 mm elevation of eyelid. So, lack of innervation to the Muller's muscle causes ptosis. Enophthalmos, it is apparent enophthalmos. It is secondary to ptosis, and also elevation of lower eyelid. Anhidrosis is secondary to absence of sympathetic innervation to the sweat glands in the face. Anhidrosis. Meiosis is due to involvement of pupillodilator fibers. So these are the components of sympathetic Horner syndrome, which is due to involvement of sympathetic nervous system to the eye. So how do you diagnose Horner syndrome? If it is a first order neuron involvement, second order neuron involvement, or third order neuron involvement. First order neuron, it travels from the posterior hypothalamus, as already told, to the brainstem, to the cervical spinal cord, to ciliospinal center of Butch. So the ciliospinal center of Butch. So lesion anywhere in the posterior hypothalamus or brainstem, like intracranial space occupying lesions, or any tumors, trauma causing dissections, or any bleed, brainstem bleed or infarcts can cause Horner syndrome. And in the cervical spinal cord, any myelopathy can cause Horner syndrome if it is involving the sympathetic pathway. So second order neurons. From the first order neurons, these fibers go above the lung apex. So above lung apex. So any Pancoast tumors or subclavian artery dissections can cause Horner syndrome. Artery dissections can cause Horner syndrome. And from third order neurons, these are involved when there is internal carotid artery dissection, cavernous sinus involvement, because they travel through the surrounding the internal carotid artery through the cavernous sinus involvement. They go to the orbit via V1 branch of ophthalmic nerve. That is branch of trigeminal nerve. So how do you differentiate the Horner syndrome? Is it a first order neuron, a second order neuron involvement, or a third order neuron involvement? To differentiate between a first order, second order, third order neurons, few tests are there. First one is cocaine drop installation. Cocaine drops 4% installation. So this says that if the Horner syndrome is present or absent. What do we do? Cocaine drops, if we put over the cornea, it will, if the Horner syndrome is present, then the pupil will not dilate. So if cocaine 4% drops are instilled, then if we can see if there is Horner syndrome present or not. If there is Horner syndrome, pupil is not dilated. The mechanism of action here is cocaine blocks the reuptake of norepinephrine. Norepinephrine reuptake into the nerve. For example, this is a third order neuron, axon, dendrite, and dendrite. So from here, norepinephrine from the synapse, it will be reuptake occurs due to cocaine. So when this reuptake is inhibited, excess norepinephrine is present at the synapse, which causes dilatation of pupil. If there is Horner syndrome, then norepinephrine is not present. Norepinephrine is not released. Norepinephrine is not present in the sympathetically denervated eye. So this eye will not respond, which is a Horner syndrome, and anisocoria will be more pronounced if cocaine drops are instilled. If this says that this test confirms that if Horner syndrome is present or not, then how do you differentiate if it is a first order or second order from third order neuron? For this, we have to use 1% hydroxyamphetamine drops. The mechanism of action is this 1% hydroxyamphetamine, it will release the stored norepinephrine in the third order neurons. The stored norepinephrine is released. So if you think this as a cell body, and this is a neuron, and these are the dendrites. Norepinephrine, which is stored, it is released in the if we instill hydroxyamphetamine drops. So if it is first order or second order neurons, third order would be normal, and it causes release of norepinephrine and pupil dilates on instillation of hydroxyamphetamine. If it is third order neuron involvement, then there is sympathetic denervation, so norepinephrine is absent and it does not release, and pupil is not dilated. So this is how we differentiate first order or second order from third order neuron, but there is no test to differentiate first and second order neuron. This is about Horner syndrome.